But first, for a few ground rules, if we can advance the slide, please. We're going to keep everybody on mute because we do have quite a number of participants this morning, but we do welcome questions. And the way you can submit your questions is at the bottom of your screen. You will see a Q&A box and you can type your questions right in there, and then we will be answering them at the end of the presentation. We will be recording today's presentation, so if you wish to listen to it later or share it with friends, please do. And we would love to hear your feedback, your suggestions on how we can be improving these presentations, as well as other topics that you'd like to hear about from RiverWoods. For those of you who are less familiar with RiverWoods, just a brief explanation of who we are. If we can advance the slide, please. We have 3 communities. The one that we're broadcasting from this morning in Exeter. We have a community in Birch Hill, which was more recently renamed to RiverWoods Manchester. And then we have a 3rd community in Durham, also known as RiverWoods. All of them are continuing care retirement communities. And if we can advance the slide, please. You know, what is a continuing care retirement community? We are actually, while many people think of us as a place to live, which we are actually an insurance product for long-term care. And because of that, our contracts are regulated by the states in which we operate. Our financial performance is reported to the state annually. And in essence, when people come to live here, they are prepaying for their assisted living or skilled nursing insurance needs. And because of that, a portion of your entrance fee when you come to live here, as well as your monthly service fees, are tax deductible. And this is really a lifestyle choice for you. When you come here, you are living independently, which frees you up from all those household maintenance chores, spring cleanup, fall cleanup. We provide courtesy transportation to you during your lifetime here. And we have a ton of activities and programs to help keep you active and challenged. And it also increases your social network here within our community. And basically, you get to stay in control of your life when you come live in a CCRC. If we can advance the slide, please, I'd like to introduce today's panelists, starting with Mary Flanagan, who is our Director of Wellness. And Mary brings to us very deep experience in healthcare, over 43 years of nursing, ranging, you know, up and down the eastern seaboard from Vermont down to Florida. Mary has worked in hospital settings with Brigham and Women's. She obtained her bachelor's degree from UMass Boston and has also a master's in nursing and nurse practitioner from Simmons. And Mary has a lot of experience working with the geriatric population and joined us in 1999 to support our residents and actually created a model for a wellness clinic here at RiverWoods that serves our independent living residents. Next, I'd like to introduce Dr. Timothy Keenan, MD, and Dr. Keenan is our medical director. He holds degrees from University of Richmond, as well as SUNY Upstate Medical University in Syracuse. And he has very deep experience, again, caring for seniors in retirement for more than 20 years. Dr. Keenan is on the staff at Exeter Hospital as part of the core physicians group, and he's been our medical director since 2014. And Dr. Keenan works closely with our staff of nurse practitioners here, supporting the wellness of our residents. Our 3rd panelist is Cindy Martin. Cindy is an RN and serves as our Vice President of Quality for the RiverWoods Group. Cindy also has very deep experience in the healthcare industry with over 30 years of experience and has for the last 14 years served as the Director of Health Services and Vice President of Health Services for the RiverWoods Group. Cindy's a graduate of Northern Essex Community College and also has her bachelor's in science in nursing from UNH. And our last panelist I'd like to introduce is Danielle Obi, who is our our licensed social worker. And Danielle's been with us for 8 years, and she holds a master's from the University of New Hampshire in social work, and has over 15 years of clinical social work experience. And we rely on Danielle to really support our residents who are transitioning from independent to assisted living. She's a fantastic advocate, provides counseling, and really helps support the psychosocial education for the RiverWoods Exeter team. So with that, I'd like to move on, and we're going to start with Mary Flanagan, and Mary's going to talk to us about the differences in levels of care that are offered by RiverWoods Exeter.
Good morning, everybody. I hope everybody can hear me. I just wanted to take a step back just a little bit, because I do believe that if we understand from where we come, we understand where we're going. So I know here in the United States, I think we have about 46 million older adults. So the big picture, when we look at what is a CCRC, it really is offering you and your family a sense of community. And within that community, we have different levels of care. There's independent, there's assisted living, and we have skilled nursing. But it's a very fluid system up until this pandemic. I know we've had to section off to protect our most vulnerable this past year, but whether you live in assisted living or skilled nursing, it's very fluid. So please understand that these level of care kind of like designations are really to help us provide you the care that you need. And we kind of do this, we decide, it's not just we deciding, it's you and your family or whoever you choose to decide where your health care is best going to be delivered. So we have staff at different levels that have different expertise, but we all share and we work together. And we review and we discuss, and you educate us on what your needs are, and we educate you on how we can best help meet those needs. And it's not just your medical care, it's also your emotional, your spiritual, and social. And that's the benefit really of a CCRC, and within that, the different levels of care. We are going to kind of work with you to make sure that you're living, as we always say here at RiverWoods, your best life. So these transitions of care, even though your space may get different, your life will be full. So we'll keep that in mind, because I know sometimes it does get hard when we have to talk about moving, as you all are now experiencing, moving from where you are currently living and moving into a CCRC. So there are differences in the care that we provide. In independent, we focus on, we're going to try and maintain your active lifestyle, if that's what you choose. Assisted living, we kind of step in and, even though the space is smaller, you still have services to, again, maintain that active lifestyle that as you define it, and we'll be supportive along the way. And even in skilled nursing, sometimes it's just a temporary stay. If you fall, if there's a fracture, we work with the different disciplines here at RiverWoods to really make it kind of your best life, to get you back up to where you want to be. And again, there's another saying we have here at RiverWoods. It always depends. It depends on many levels of factors, but we always keep the conversation going. And these, like I said, these transitions of care are always going to be a deep conversation along the way. So I think we can go to the next slide. So the wellness clinic. Okay. So yes, we have the wonderful world of wellness. Years ago, it was only RiverWoods, the Woods campus, and then we have the Ridge and the Boulders. And each campus has a wellness clinic. It is each staffed by a nurse practitioner. And we also have a registered nurse. And then we also have, We also have throughout our community here, we have our enhanced home service program. It's a group of, I have 2 LNAs that help residents kind of maintain their independence or transition if they need to. So it's a little extra help. But within each campus, we have not only social workers, we work with your dining committee, we work with, sorry. We work with maintenance to make sure your apartment is accommodated for you. We also collaborate with the front desk. Our residents have a lot of different committees here. So we work with all of you to find out what your needs are and how we can make it better for everybody. So we do many things. I actually have an old list from one of our talks in the past. And we talk about the wellness clinic kind of being a mini urgent care, but we are not your primary care office. So we work with the local providers to make sure that your healthcare needs are met, as well as your emotional and spiritual, as well as social. We also do medication management, blood pressure clinics. We have referrals. We have a contract with a local lab who helps get some blood labs drawn for you. We also do EKGs. We have a wound clinic. We have a hearing specialist, podiatry, dermatology. We have a wonderful rehab team that we also utilize throughout all the campuses for OT, PT, and speech. And to back that up too, we also have fitness. So you have a whole cadre of support systems here. And so many of what you need can be, again, helped through the wellness clinic. And I always say that our main goal for wellness, no matter what campus you're on, is we're going to help you have access to healthcare. However you define it, we're going to help you. And I think we also have an emergency response here out of the wellness clinic, but I think Cindy's going to talk about that. And we have a strong, supportive social service department, and Danielle is going to talk about that as well. So any questions, always just feel free to call us. If you're not sure, call us and we'll direct you to wherever you need to go. So I think we can go to the next slide.
All right. Hello, everyone. So as Mary alluded to, there's a lot of other support services that are offered here at RiverWoods. So in addition to the wellness clinic, who you may have gotten a feeling is sort of the hub for kind of getting you out to other services, we have physical therapy, occupational therapy, and speech therapy available right here on campus. Whether you get that referral from your primary care provider or from one of the wellness clinic nurses, we are able to provide that here on campus in your apartment. One of the great things that I found as a support service for our residents, whether they're maintaining in their independent apartment or their healthcare living situation, is that all the ways that physical therapy not only gets you better from an injury, but helps you maintain your independence at whatever level you're at. So that could be anything from taking a look at your apartment to make sure it's as safe as possible, to giving you the supports that you need to maintain your independence, such as a walker or assisted devices. So those supports are really an important piece of what we do here at RiverWoods Exeter. In addition to that, the social support of both the social work department, but also just the community that we offer here. I think you'll find when you either visit or come in to live, that we really pride ourselves on being a community, and that's a community of staff and your fellow residents and your families when they visit. We do follow HIPAA guidelines, but that only means that we can't tell you about other people's healthcare information, but we always encourage you to let us know if you have any concerns about yourself or about your neighbors. As Mary said, give us a call. The wellness clinic is sort of a great place to then connect you to outside supports that you might need, whether that's therapy. It could be supports that we can bring into the apartment, such as outside agencies to help you, or we have mental health and hospice referrals that we help support you with while you're here. So really, it's just about looking at each individual person, finding out what they need, and then seeing what we can do to support you. And that's not just healthcare, that goes to the front desk, maintenance, dining. We're all here to make sure we support each person so that they have the best quality of life possible. Does anybody else want to? Oh, there you go, Cindy.
Good morning, everybody. I'm joining by my phone, so I'm hoping that you can see me and hear me okay. I'm not seeing myself on the screen, so I'm hoping this is working. But basically, we do have an emergency response system. It's our internal system designed to provide supportive care and service for medical and maintenance emergencies. And essentially, when our residents move in, they are provided a pendant which they can push, which would summon security and nursing to respond to an emergency. And there are also in the apartment bathrooms, as well as the common bathrooms throughout the community, pull cords and buttons in all of the common areas that one could also use to summon the service of security and nursing. So basically what happens is when we respond, nursing is responding with basically a triage bag, so we can check vital signs. If it is that somebody has had a skin tear, we can do some bandaging, some dressings. If it's that somebody has had a fall, we can certainly help somebody get up if that makes sense in the moment. And basically we're doing an assessment and triage to understand what the next steps are. Sometimes it is a false alarm. We're always happy to respond, make sure all is well. Sometimes it is somebody just needing a little bit of light support, and we would recommend that they would follow up with the wellness clinic on the next business day, or perhaps their primary care provider if that is appropriate. And sometimes it is a matter of calling 911 for an emergency transport to the hospital. That is always your choice if you're able to respond to us, but you certainly have choice with this. And we can certainly talk about the risk and benefits at that time. Sometimes folks will feel like they're okay, and we might decide that we're gonna just circle back in an hour or so, just to kind of check in and make sure that you're either feeling better, or if not, talk at that point about what the next plan might be. But there certainly are always options to follow. Typically what we will do is, regardless of the outcome, the wellness clinic will on the next business day just follow up and circle back to see how you're doing, and make sure there isn't anything else that we can provide from a care or service perspective. And I guess the one thing that I would really want folks to know about our emergency call response is that it is there to be used. I think sometimes folks feel like if I press my emergency button too many times, then I might actually start having some conversations with the team about needing to move to healthcare. And that certainly is not the case. It does not need an immediate move to healthcare. We are not making any hash marks, and once you hit 10, that's it. I've actually had a resident who said, well, gosh, I had a neighbor who fell down, and I thought about pushing my button, and I wasn't sure if I pushed it, would it actually count against me? So we want you to use the pendants and the buttons as needed, so that we can provide the care. That's what we're here to do. We're here to provide peace of mind, care and service to you as you need. The other thing with our emergency call response, or linked into that, I guess I would want to mention, is that we also have motion sensors, motion detectors that are in all of the independent apartments. And basically they are set up, they are designed to trigger an alert system for our team if somebody hasn't moved past them, meaning they haven't gotten up in the morning to go to the bathroom or to access the kitchen. No worries, they're not set at 7 a.m. We set them later in the morning, and certainly if somebody is a very late riser, we can make some exceptions to those check-ins, but we do a courtesy check-in just to make sure that all is well. Typically that's our reception team that will just call. And if you don't respond, we will have a team member just come by to do a wellness check. So that really, I think, kind of rounds out our emergency response, and certainly happy to answer any questions about that when we reach our Q&A. I think we can go to the next slide.
All right, so what is your approach to memory care? So our approach to memory care is really integrated into everything we do here, all the services that we provide. We really take a person-centered approach to memory care. They say if you've seen one person with dementia, you've seen one person with dementia, because it's really a disease that's doesn't have a one size fits all solution. So what we really do is we get to know our residents. We get to talk with their families. We have an approach that's really about keeping each person at their highest level of functioning and giving them the highest quality of life that we can. And so, we do that in a variety of ways that we've sort of talked about as we've gone through. But really it's about trying to age in place and making sure that we are looking at each individual person and what they need. And does your staff have any special training? Absolutely. Our staff have in-person training that we provide annually, in addition to online courses that we take. So we definitely consider that training to be an important piece, but it's not the whole picture. Really getting to know each person is the best training that we can have, because nobody can tell us how to care for an individual better than themselves. And so we do some assessments upon entry, letting us know who somebody is kind of at their highest level of function. And then throughout the process, we may do that again to see sort of where the changes are. We also have advanced directives in place that can let us know what your thoughts were of how you wanted to be cared for. We also have special documents that we have used with our residents called Speaking for Myself. It's a document that lets us know how you want to be approached and how you want to be cared for. It's not anything we require, but some people feel that really gives them peace of mind that they've been able to put their thoughts and let us know how they want to be approached and taken care of. And as I said before, we also integrate family, making sure that they're a part of the process, talking about, their loved one and who they always were and what they would have wanted. And so that's really a big part of our memory care, is that individualized person-centered care.
You're on mute, Mary.
Sorry, guys. A few people came into the clinic. That's why I put it on mute. So how do we handle transitions? So I guess I'll start again by going back. So when people are interested in moving to RiverWoods, you will go through a health assessment with either Patty or Emily. And during that assessment, we kind of get to know you. We understand what your needs are. You tell us what you want. And we want to make sure that it's appropriate for you to come to RiverWoods at certain stages in your life, because we want to be able to care for you in a safe manner. So once that assessment is done and you're here, again, utilize a wellness clinic, fitness, OT, PT, whatever it is to keep you at your best self. But as time goes on, if you need more help, and this is where wellness comes in, your primary care comes in, social service comes in, we have family meetings. There's just a lot of conversations to figure out where can we meet your needs best. And when we do that, it takes time. And we always talk here at RiverWoods about planting seeds. So we're trying to just give you information about what the next level of care will be, and how it will serve your needs best. And again, it always depends. It's always about conversations. We don't force people to move. And you can have 20 e-calls. That's the emergency response here. And it's okay, but we want to know if you're having that many e-calls and how can we help you where you are? So again, it's about conversations, but that's how we basically handle transitions, is lots of conversations and getting to know you as a person. Next slide.
All right, what types of support does social services offer? We have all sorts of types of support. It goes back to that individualized approach. One of the things, just sticking with healthcare, that social work does is, if you're ever with us and you find yourself out at the hospital, whether it was an unexpected illness or injury, or if you had a planned surgery, the social work team works with the hospital. We liaison with them, so we know when somebody's out at the hospital. We know sort of how things are going, when they're planning to come back, and what level of care they're going to need to come back at. Many of our residents return to their independent apartments, but sometimes they need to come in for a short time stay in health services. And so we will make sure that that is coordinated, that we figure out how we're going to get you back, and plan for your care upon your return. The social work department also offers counseling services in the short term. So whether that's one-on-one counseling or couples counseling, or maybe work within your family, we offer that support. As Mary was just talking about transitions, transitions are hard. Looking at whether it's, losses to who you are as an individual or your physical abilities, those things are really hard. And we recognize that here at RiverWoods. And so we try to offer support in independent counseling, in support groups. A couple of the groups that we've run here, we've had right now with COVID, things are a bit on pause, but we've had caregiver support services, Parkinson's disease, we've had grief support, and we actually offered a Zoom COVID support group that we ran as well. So whenever there's a need that sort of pops up, we try to take a look at that need and see if we can meet it. And in terms of kind of the other things that we do, if the counseling that we are offering isn't kind of enough, we are happy to look at referrals, whether that's finding somebody out in the community where maybe you can have more, outside of RiverWoods therapy, we do that as well. Other services that we have come in, as I talked about before, is we can certainly connect you with hospice services or palliative care support if you need it. We have had people bring services into their apartment for various things. We'll certainly help with that. We've had people use music therapy in the past, pet therapy, anything like that. Whatever is going to sort of fill you up as an individual. We also will work with people on, maybe you have some questions about bills or changing insurance. We're not experts at that, but we can certainly sort of help steer you in the right direction. We have really great local supports that we can refer you out to as well when you're struggling with sort of making those decisions. And we certainly help and facilitate having advanced directives. So that can be, your living will, your power of attorney for healthcare. We also have additional supports that we use here, such as code status and sort of a post form, which is something that we use to sort of let us know what your sort of kind of medical thoughts are on how you want to be cared for. So that's a whole nother power to do that. But not sure if I feel like I do a lot, and I might have left some of it out. I don't know if anybody else can see a glaring hole there, but it's a lot. We help people with a variety of things.
Good morning. My name is Tim Keenan, and I'm the medical director of RiverWoods Exeter since 2014. And just to add to what Danielle's saying, she was saying that she does a lot of other things that she didn't even mention. And one of the things that I find that I work with Danielle a lot is a liaison between families and myself. There are times when she will be in a lot of contact with patients or with residents' families. And then she might pass something on to me that if a family has a particular concern about something that's going on with mom or dad, then I typically am in contact with her every week talking about what's going on and what needs might need to be met. So as a medical director, one of my primary roles is to be a resource for the nurse practitioners. There is a nurse practitioner at each of the 3 campuses of RiverWoods Exeter, and I'm available for them for questions and for co-managing patients. And I'm a resource for the administration when it comes to particular type of medical questions that they might have or policies that need to be worked on. And I'm also a liaison for the local doctors and specialists from the Exeter Hospital area or for other areas if they have questions about patients at RiverWoods or concerns about patients at RiverWoods, or if we have residents in RiverWoods who are having a hard time getting in touch with their physician, or the nursing staff is having a hard time getting in touch with anybody, then I serve as a liaison with them as well. My primary role and what I spend most of my time at RiverWoods doing is taking care of residents that are in the skilled nursing section. Each of the 3 campuses has a skilled nursing section, and the residents that are there are able to go out to see their own primary care physicians if they've had established relationships with primary care physicians. And there are occasions when some of the local primary care physicians are coming into RiverWoods, and we welcome that. And then if patients are unable to get out to see their providers because of their physical status, or don't desire to go out to see their providers, then I become their primary care physician at RiverWoods. So I take care of about 2/3 of the patients or residents that live in or reside in the skilled section of the 3 campuses. There are occasions in the assisted living. Most people in the assisted living are able to get out to see their own physicians, but there are occasions when that's not possible, and I take care of them as well. If there are times when somebody's due to see one of their physicians, or if there's a small issue going on, a particular rash that needs to be looked at, or somebody's ears that need to be looked at, and it is too difficult to get out to see their physician, then I would do that as well. But that's also working in collaboration with the 3 nurse practitioners who are there most days of the week and are usually right upstairs and have pretty good quick access. So I work a lot with them and rely on the nurse practitioners to do that, who are absolutely wonderful and certainly do not need much guidance from me, that's for sure. They're all very experienced in geriatric care, and I have certainly learned a lot from working with the 3 of them. I work with the quality committee for setting policies and looking at overall trends if there are certain things going on. And certainly the last year with COVID-19, it's been very busy as things have changed on a daily or weekly basis for the last 14 months. And certainly things are doing very well with respect to that. And I'm sure there may be some questions related to that. But Cindy, you can certainly correct me if I'm wrong, but we have done very, very, very well at RiverWoods Exeter, and certainly not without its troubles, because it's certainly limited a lot of various activities and getting out and about. But that was the downside. The upside is we had done extremely well helping to keep the virus out of RiverWoods Exeter and have a greater than 99% acceptance rate for the vaccine amongst the residents, which I think has really helped us have a community focus, remembering that this vaccine is not just for the individual, but it's for the good of your community. And we've had an astounding results with people wanting to get that vaccine. And I think that's really helped us to pull through.
Yes, no, absolutely. I think it's this past year plus has certainly not been without its unique challenges. However, we have had a wonderful adoption rate. The residents absolutely at 99%. Our staff the adoption rate right there is at about 80% right now. And I was just looking to do round 2 with those who have not been vaccinated yet and provide them another opportunity, if you will. We are actually in the process of working with our long-term care pharmacy so that we can actually do COVID vaccines ourselves. We had a federal partnership with OmniCare CVS, and they came on campus and did all of our vaccines when they were limited in availability. So it's kind of nice to be out in front of all of that, and really had really a great response. But we're not going to give up the fight yet. We're going to keep offering that COVID vaccine. And I think as far as the number of cases that we've had, we've really been in an enviable position, over the past year with really minimal impact. We didn't have any hospitalizations related to COVID. And many of the few cases that we had, relatively few cases, were asymptomatic, no symptoms at all. So we're really very fortunate.
Great. Well, now it's time for questions and answers. So if you have questions, you can enter them into the chat box, excuse me, not the chat box, the Q&A box, which is at the bottom of your screen. You may be on a device where that appears on a different side of the screen, but it's labeled Q&A. So I'm going to jump right in. We have a question about how many residents have long-term care insurance, and what percentage of the residents use that outside long-term care insurance? That is not one that I am familiar with. I don't know, Cindy, do you have an answer to that?
Yeah, I could take a stab at it. I don't know that I know the percentage of folks who have it. I know that we generally, when folks move in, we'll say, it's probably important if you have one to hold on to it for about a year, just until you're kind of settled in, and we have the opportunity to review it with you, because I like to say, if you've seen one long-term care insurance policy, you've seen one long-term care insurance policy. They're all worded a little bit differently with different criteria as to what triggers the ability to utilize it. But we have, I would say historically, folks living, either in assisted living or in our skilled nursing, we may have one person at any given time that is accessing that benefit. Many people choose to part with it after they're at RiverWoods for a while, realizing that we are their long-term care insurance product.
Mm-hmm. I will jump on that as well and say that the people who I've had in healthcare who have kept their long-term care insurance, I would say take a look at your policy, as Cindy said, find out at what point it starts paying, because I have some people right now who are in assisted living and they're struggling to meet those criteria. So really the question is, as Cindy said, what's your policy? Take a look at that and really understand it. And also, I would say also make sure that, whoever would be the person to help you with that, if there's a child or a close friend, that they understand it. Because I think that the nitty gritty of it is really whether that policy is meaningful for you or not.
And I'll just mention that in the 20 plus years that I've been here, for our independent residents, I've only seen it used twice.
Yeah.
As Cindy says, RiverWoods is your long-term care insurance, but hang on to it. And then you have to realize and you can talk to the finance department, you can talk to marketing, you can talk to us in wellness, social service. We can help you walk through it, because sometimes people get attached and then they're afraid to let go. But have a conversation. Okay.
Great. Thank you. We have a couple of related questions about what health services are covered by the monthly fee, and how does it work when people go into assisted living or skilled nursing in terms of cost and how that's paid for. So Cindy, do you want to answer that one?
Well, I think maybe it's probably best to think about this between level of care. So a monthly service fee, a lot of the services that are provided through our wellness clinic are honestly not billable services. We generally like to think about it as if you get out the prescription pad, right, Mary?
Right.
If there was an assessment and diagnosis and then an intervention with a prescription, then we would bill your Medicare insurance and secondary insurance for that visit. But that doesn't happen terribly often. So your monthly service fee is covering, your room, your apartment, your one meal a day, unless you've chosen a different plan. Once you move into assisted living and nursing or nursing, then the additional fees would be related to 2 additional meals per day. So any care that is provided is covered under your monthly service fee. The only time we would be billing out to your insurance would be if you are accessing our rehabilitation department, our physical therapy, occupational therapy, or speech language pathology, or if you've been out to the hospital and had a qualifying stay to come in under a skilled nursing benefit, then we would bill your Medicare. That's 100% for the first 20 days. And then the additional remainder of your, they call it a spell of illness, would be covered at a certain percentage, and the rest of it would go to your secondary insurance. There may be a small, minimal co-insurance that we would have to bill the resident for, but by and large, it is covered by your insurance. I'm hoping that gets at the answer to the question.
Sure. One of the specific questions was, is there a cost to the wellness clinic? And that answer would be no, because those services are covered by the monthly service fee.
Right.
Yeah.
And we try, our goal is to kind of keep you healthy, and we try and do a lot of proactive things, which are not, necessarily billable, but we're going to educate and we're going to refer and work with you. So, we have, like we all mentioned before, all the services here. We even have like dietary is another thing. And so there's just a slew of services that that's actually no cost.
One thing,
So-
Mary. Oh,
Go ahead.
I was just going to add in one thing though, Mary, with the wellness clinic, visiting the wellness clinic is part of the fees, but there is a charge for those enhanced home services you talked about earlier.
That's true. That's extra. We explain that. If they need some extra services in their independent apartment, we do bill for that, but we'll have a conversation to explain all that. Yeah, but that's not part of your regular monthly service fee. It's mostly about, maintenance, shoveling your car out in the middle of a snowstorm.
And also related, if we are an insurance, if RiverWoods is an insurance product, do we pay for primary care off campus?
We do not,
No.
but your insurance does.
Right. Right. Medicare and your secondary insurance does.
Yes.
Great. And
I can add into that a little bit as well. So if you went to you'd go to your regular doctor, and your Medicare or your secondary would cover that as you would normally would with regular doctor visits. But where it can be very handy is that sometimes you're a little confused about a refill, or sometimes you need a little bit of help, or sometimes you just need your ear looked at, or a certain skin rash looked at, or maybe you're feeling a little bit short of breath, or you've got a cough or something like that. You've got a wellness clinic on each of these campuses with a nurse practitioner. So you do still have your own primary care doctor. The wellness clinic will not serve as your primary care, but they help the primary care doctors out in the community immensely. One example might be where I have somebody in my office who has high blood pressure, and we're not sure if they need a medication, or maybe we're going to start a new medication. I can give them a log sheet. The wellness clinic will check their blood pressure for me twice a week for 4 weeks and fax it back. And then we can decide if we need to go up or down. So the wellness clinic is included with the fees. And it's kind of having a little concierge type side benefit to enhance your relationship with your primary care provider.
Yeah, Tim, I think that's a great point. And I don't know that this has come up yet, but one of the great services that our nurse practitioners, our wellness clinics provide to our residents is kind of that care management or case management, care coordination. So, when they are seen, when our residents are seen on campus, they are sending note to, the primary care physician and any specialist, and making sure that they're all in the same loop.
Right.
make sure that, everybody's on the same page for what the residents' particular needs are, and what services they're receiving.
Sure.
Yeah.
So a great example would be just yesterday, Emily Stewart from the Ridge sent me an email about what somebody walked down to her office and said, I'm having just a little bit of more difficulty swallowing lately. And she sent me an email, said, I've increased his acid blocking medications and referred him to speech therapy, and I'll let you know what happens. And my answer was great, perfect. It's exactly what I would have done. And it's done and taken care of already, so it's been very helpful. And of course, speech therapy, physical therapy, and occupational therapy are all right on campus. And to be able to get in and see them is very quick. So.
Great. So we have a couple of questions about how people obtain personal physicians. Do we make recommendations or help line them up with PCPs or specialists? And then also a question about who pays the fee for that.
There is no fee for us for helping you decide who you want as a primary care. Core Physicians, which is associated with Exeter Hospital, prints out a list of available physicians. And one of the social workers sends it out to all of us dentists. He sends it to us so we can then hand it over to our incoming residents. And we just have conversations. The nurse practitioners will try and get to know those primary care physicians. We'll ask the resident, what are they looking for in a primary care? And then we try and match. And you can always call up and have a meet and greet to understand if both you and the physician are on the same page. Because you have to feel comfortable with your primary care because they are an important part of your healthcare. And it doesn't cost anything.
Yeah. We usually spend a few minutes just asking questions about you personally. What do you look for in a physician? It doesn't matter what gender they are. Are you looking for somebody young or older? Does it matter, that you like aggressive care, or you're looking for more of a palliative approach? So those are the kind of questions that help us sort of steer you in the right direction. And, we always encourage people to, give a try. If that's not a good fit, you find somebody else. We've had people here who, have maybe jumped around a little bit until they've found that right fit. And it's important to do that, especially if you're going to be moving into a new area and don't really know anybody.
I think our residents are not shy in sharing their insights as well.
Correct.
So there's definitely a lot of word of mouth that happens.
Yes.
Okay, we have a couple of questions about the COVID vaccine. Do we require staff to get it? And what percentage have gotten the vaccine?
Yeah, we have not made it mandatory. It is still obviously under the emergency use. So there's a lot of thoughts about whether that is something that, the communities or hospitals can actually do. And we've actually had a really good response. So we have about an 80% adoption right now, and climbing, I like to say. So it's not over yet. As I think I mentioned earlier, we're just in the process, just this week, of moving towards being able to actually offer it and administer it ourselves on campus with a partnership with our long-term care pharmacy. I will tell you that I know that there was a study by the CDC in February, and they looked at skilled nursing facilities across the country. And New Hampshire actually was recognized as being the state that had the highest level of adoption of its healthcare workers in skilled nursing. And we were right in alignment with that. So I'm feeling really good about where we are. Certainly there are some folks who have not received the vaccine. Some of that, typically based on, advice from their physician. We've had folks who are pregnant who are somewhat hesitant, or they may have a clinical condition that their physician has said, maybe it's best to wait a little bit, before you actually receive the vaccine. So I think we're doing well with it, and we will continue to thoughtfully encourage and cajole folks.
So we have a few related questions about health assessments that are required for entry into to become a resident at RiverWoods Exeter. The questions include what is entailed in the assessment. Are there any conditions that would prevent someone from being accepted as a resident? and what happens if they fail the medical interview upon arrival?
So I'll start. Essentially, what we're trying to do, again, as I mentioned, is to make sure that, are you going to be able to live independently? You are coming from your home, and some people have been in their homes for many, many decades. We're moving to a new surroundings, new people, new numbers, new directions, and that may be overwhelming. So we try to anticipate if there's any either physical limits, but that won't, again, prohibit you from coming in. I mean, we've had people of all sorts and shapes and sizes. As long as, you can accommodate to the new environment, it's fine. Sometimes it's more the cognitive piece, because we can't, unfortunately, even though we're working on it, we can't fix certain types of, with dementia. And it's important not to set somebody up to fail. So we want to make sure that when you move into RiverWoods, into that independent apartment, that we are going to be able to support you. So when you do these health assessments, and we do a physical, we do your blood pressure, we ask you some cognitive questions, we ask you your meds. We're only trying to get a sense of who you are and are you going to be okay to be in this independent apartment, because we do not want you to fail. And we don't say that you fail the assessment. It's just like, we look at it a little differently. It's like, bringing you into an independent apartment is not going to be the best for you. You may be better served in an assisted living area. So that's where we have a conversation. So if the criteria is not met during that assessment, we'll have a conversation with you to make sure that we suggest other places that might be a better fit for you at that time in your life. And these conversations are hard, no doubt. But please understand that we're trying to prevent any bad cases. It's just not fair to you as a resident coming in.
Thank you. We have a couple questions about how does it work if a couple is in independent living and one needs assisted living or skilled nursing support on a potentially long-term basis. How does that work cost-wise for them?
The way that works is when you come in, you have your set monthly service fee. And so that doesn't change based on where you're living. So financially, the only difference that you'll see is for the additional meals per day. In healthcare, we provide you with 3 meals a day, in addition to any snacks that you need or supplements. And so that's really the only financial difference. Of course, if that person needs any rehab services, as we've already indicated, that will be billed out as we already spoke about.
Right. And we also, if one spouse or partner is in the independent and the other is in the lodge or skilled nursing, prior to COVID and COVID, we always have to put that little asterisk in there. There's freedom back and forth. Sometimes we used to have people, maybe you want to go have dinner with your spouse. So the person from the lodge goes to have dinner in the independent apartment and vice versa. So it's, again, keep that in mind, that the transitions amongst the different levels of care, the goal is to be fluid, and we'll get back there soon.
We will.
We will.
Great. So we have just a couple minutes left and a number of questions left. So if for some reason your question isn't answered today, please reach out to myself or Diane Smith, and we'll get an answer for you. One last question we're going to answer is, how are the HIPAA guidelines handled with regard to communication between medical staff and family concerning a resident's health issues?
We follow HIPAA guidelines just like any healthcare provider or provider in general would. We are able to share information for your care purposes, so we can communicate with your primary care provider. But we also are very, it's very important to us that we talk to you about who we can be talking to. So getting permission to talk to your doctors, as well as getting permission to talk to certain family members. We ask you who those people are. If you do not give us permission to talk to somebody, then we do not talk to somebody. And so we have those conversations when somebody's entering the RiverWoods community. The wellness clinic handles that. And when you're moving into healthcare, whether it's assisted living or skilled nursing, then social services is handling that.
Thank you, Mary, Danielle, Dr. Keenan, and Cindy for your time today. Thank you all for tuning in. And we have a wonderful presentation coming up on the 18th of May featuring Martin Pisani, who is a leading wellness expert. And we hope you'll join us. You can go to our website and register for that. And we appreciate, again, your time this morning and wish everybody a wonderful day. Thanks so much.
Thank you.
Thank you.
Thank you.